Yeah, my name is Dr. Anzo Adiga. I'm an obstetrician and gynecologist working at Moyo General Hospital. Moyo General Hospital is close to 500 kilometers away from Kampala, and you cross the Nile twice. The Nile which separates us from Kampala, you cross it twice to come here. And I've been working as an obstetrician and gynecologist for the last 4 years. And together, when I worked as a general practitioner, this comes to about 12 years of experience. And I enjoy working in Moyo here for being a very hard to reach and hard to live place, because the service goes direct to those who are really in need. There was a mother who was who was bleeding, a teacher, and that teacher was taken in to be operated. I think something which now I know as antepartum hemorrhage, somebody bleeding when is pregnant. And there was nobody to operate her. After a short while, I saw people were crying. There was blood drop. As a young child, that went to my brain. I couldn't forget it. And they told me the mother died with the baby inside. So the mother and baby died of this English teacher. Then I asked my dad what should have been done. He said if there was a doctor, they will operate and remove the baby. Both of them will be alive. Then that was the end of my dream of being a lawyer. I said I want to be a doctor, and a doctor who will do such operations. So that's how it took a lot, but that's how the pull factor, that's what has dragged me to be a doctor. And I think I don't regret, because I've never lost anyone to APH. Biggest game changer to me right now is simulation. Skill simulation. We need to have a capacity to constantly train health workers, train and retrain them. That if you have PPH, this is how we manage. If you have APH, not to wait for the condition to come. This is how we do it. And it's the biggest game changer. We tried it in Molago. It's working, and this region we don't have. That's what you need. You need the mannequins. You need these samples where you can demonstrate. You have a kind of a center that have a simulation within the hospital, that every quarter at least you have a simulation. You create a scenario, you do this, and so that the skill goes to them and remains with them. So to me, the skill is the most important part, skill and reskilling. Then the second part is the supply, to be sure that the people who are skilled, they have what to use their skill for. Pipeline has made it possible for us to have better skill and supply side, because when we had an opportunity to interact and have ultrasound available, cardiotopograph for monitoring mother and patients monitors, generally this motivates someone to work even more than salary does. Because if you know I wake up in the morning, I have what to use thanks to pipeline. We are actually the second government facility in Uganda to be having such monitoring tool for mothers in labor, so that you can monitor the mother and the baby at the real time. It's a big motivation for my staff, and training them to know what to do, it actually increases their morale to work. On the patient's outcome, it helps us go extra mile using bedside. I think a week or two after you delivered us the CTG and the ultrasound machine, we had a near miss where we worked on one single mother who had ruptured uterus for almost 12 hours. The team worked on her and saved her, and everybody in the team said if we had not detected that she was bleeding, and thanks to the bedside ultrasound, because there's no sonographer by that time. And so when we scanned and found there was a bleeder, we took her back, we worked on her, and we had a gadget to check where the blood vessels are, because the veins had collapsed. We were able to get vein up to down and go to like 5 sites to save her. And to our dismay, after just 1 week, to our disbelief, we saw her walking. She came walking, we made her to sit there, we did the review of near miss. I think had it not been because of the availability of some of those equipment, that mother wouldn't live. And with partners like Pipeline and more partners, I think Moyo should be able to, being isolated in a small place, we should be able to attain less than 70 maternal death per 100,000 live birth by 2030. We should be able to attain easier than other parts of the region. Less than 12 neonatal mortality per 1,000. These are achievable, especially with good supply, with good skill, with good simulation, and it will be a good place to live. Moyo will be an island of healthcare excellency. Thank you.